My name is Dr. Swati Sharma. I'm an educator, a counselor, and a mental health consultant. Today's topic is social anxiety disorder. And I'm here to just give a very quick peep into it as far as the symptoms of this disorder is concerned and some very quick and easy to use techniques for the same. So, what is it like to experience social anxiety? Is it very difficult for me to interact with other people? Do I feel excessive shyness? Do I fear judgment and evaluation? Do I feel the fear apprehension of coming in close contact with other people and being scared of the consequences for the same? How is it different from a normal anxiety? So it just takes one extra mile when it makes you maladaptive, when it makes you dysfunctional. So we are not just looking at anxiety and shyness and fear and tension and worry when we are coming across other people. It becomes a problem when we are not able to function because of the fear of the same. So being excessively shy in the presence of other people and when it's making me underperform or not perform at all is just a small example for the same. So the terror experienced by patients is so intense that it makes them dysfunctional and it makes coping very difficult for them in their everyday life. So what can we really do what are those things that we can easily do to prevent ourselves or to handle ourselves when we are experiencing social anxiety? So what can we really do to prevent ourselves from social anxiety? Or in case of an event of extreme social anxiety, what are the things that we can do? Can we control our breath and focus all our attention on our breathing for 2 to 3 minutes? Inhale and exhale and bring back our conscious awareness to the immediate environment that we are a part of at that moment. Positive self-talk also really helps. So there could be a million negative thoughts in our mind, but just at that point of time, if we are talking to ourselves in a way that makes us feel more confident and takes away these negative thoughts, we can be our own therapist at that point of time. We can try and exercise. We can try and engage in a behavioral disengagement where we could be doing something else, or we can just change our environment for a bit. Strong peer support is also a very good technique. Entering into situations where we have people whom we can trust just to start with and giving ourselves a platform where we can start interacting with people, but in a more comforting environment where we have our own peers at the first levels when we have an episode of anxiety. We can also take our focus from ourselves to the environment to be just present in the moment, looking at things, observing other things. We can be away from the negative self-talk. Like I said, we need to be more focused on communicating to ourselves in such a way that we are not passing any negative message to the brain. Because again, if we talk negatively to our mind, then we are going to be programming in a negative way. Thank you.